Hi, my name is Madeleine Tait and I'm a musculoskeletal and sports podiatrist in London, and today I'm going to talk about posterior tibial tendinopathy. This tendon is vital for general health of your foot and ankle. It connects your calf muscle down to the inside of your ankle, down into the middle of your foot, and its main job is to create the medial longitudinal arch of your foot. So when you find this tendon is injured, what you'll experience is pain generally when you're walking, doing any sort of sports and exercise, and it can radiate from the middle of your foot all the way up to the inside of your ankle. And it's important to get on top of this injury or pain here nice and early, as it's often a cause and contribution to the development of an adult-acquired flat foot. This meaning the development of a functional change to your foot and ankle position, which will significantly affect how you move and walk and ability to perform daily active tasks. So overuse injury, particularly involving moving dynamically left and right as well as forwards, so running and general functional movements can contribute to increasing risk for this tendon. So an increase in the intensity or the duration of your sports and exercise. Footwear changes, so potentially from wearing more unsupportive shoes, these will increase the load through this tendon and ask it to do more. Age and obesity can play a part in increasing risk of this tendon getting injured, as well as some previous injuries and biomechanical features that might contribute to increase in load through this area of your foot. So symptoms of tibialis posterior tendinopathy. So these will involve pain and ache down the inside of your ankle, pain when trying to stand on your toes or go up and down on tiptoe, pain when you're moving your ankle inside and out, instability, so you might feel slightly off balance, or it might be worse when you're moving or running or trying to perform some exercise. It's often, you might notice some swelling on the inside of your ankle and heaviness to your foot, and it might feel better when you're in a more supportive trainer or ankle boot. Diagnosis of tibialis posterior tendinopathy. So this can be made in clinic, so we can see whether this tendon is injured from some functional tests at an appointment. So it's worth coming to see a podiatrist like myself early to get on top of this injury to this part of your foot. If we seek a need for more further intervention, we can look at MRI and ultrasound really to explore the health of this tendon, to see if it's thickened, or if there's any fluid in and around the tendon, or if it's ruptured. So we can arrange this as necessary. So treatment plan for tibialis posterior tendinopathy depends on often the severity of the presentation, but often we'll suggest a bit of rest to begin with, or if the pain or severity is quite advanced, we might suggest an air cast boot or a period of an offload. Ice can help if we're experiencing some swelling or inflammation, and often medication or anti-inflammatories, non-steroidal anti-inflammatories can help as well. For more functional and improvements in mobility, we'll suggest orthotic therapy. This is really helpful for this type of injury. Orthotic therapy can also be really useful for this tendon. The role of a medical device such as an orthotic will provide a shortening of this tendon. This tendon, when it gets injured, can feel and functionally be quite long and weak. So the orthotic component will really help to take pressure off the inside of your ankle, hopefully enable you therefore to do a bit more and work on a strength plan once this tendon has been offloaded. In addition, if we seek a need, if this is advanced and we seek a need to provide further intervention, we can look at an ankle foot orthotic, such as a Ritchie brace. And the concept of this would be to greater offload and couple the foot and ankle. As I said, the tendon runs down the inside of the ankle into the foot, so by providing a brace, it provides a longer lever and can really help with offloading this tendon. And the main aim, therefore, is to provide you improved function, reducing your pain, and improve your mobility. So a good strength and conditioning plan would be coupled together with this to provide long-term management for you, returning back to your daily life or sports and exercise that you're trying to achieve. If you've been experiencing similar symptoms to what I've explained, such as tibialis posterior tendinopathy, or would like to discuss anything further, please get in touch. I'll be very happy to see you for an appointment.